So we are live from PLS 2025, another episode of our podcast, The Leaders of PLS. Joining me, Kim Simmonds. Thank you for being here.
Thank you for having me.
So you're the CEO of Primary Care Alberta. I'm going to read that part because I want to have it right.
Yep.
Primary Care Alberta is the front door into our health system. Very much aligned with First Line in Health, actually. Your main goal is to ensure everyone has access to high-quality primary care services across the province.
Correct.
Now, we want to know how you do it in Alberta, right? As we know, Alberta is a pioneer in the establishment of primary care networks. How would you describe Alberta's approach to primary care, and what makes it unique compared to other provinces like here, like Quebec?
Yeah. Right now, what makes us unique is that we are the only province that has an agency that's dedicated to the governance, organization, and coordination of primary care. So that's what Primary Care Alberta does.
So it's an outside
Agency that reports into the Minister of Health, that's responsible for all of those primary care networks that you talked about, all of the interprofessional care that works across the community health system, and making them work in a coordinated and accountable way so that we can ensure that everyone has access to health care.
Okay.
Yeah.
And how do you see, is that working?
So we've been operational for about 4 months.
Okay.
What we've seen already, though, is it's a great opportunity to have us at the same table as acute care. And that means we can really shift the conversation to prevention, to care in the community, and all those things we know that are important to do, but we've just always had to focus on emergency room departments. Now we are there saying, this is what we need, this is how we have to work together.
And are people from Primary Care Alberta, are they from the field? Are they people from the first line?
Yeah, so that's a great question. Yes, we run clinics, but we also work with our partners who run private family medicine clinics, and we all work together as a collective because everybody wants to do the right thing, which is really helping people get care earlier and in their community. And so we've had tremendous success with it and really helping to push that kind of care in the community and care from the right provider for you.
And bring the right solutions because they actually know what's going on.
Absolutely. That's one of the greatest things is we go out, talk to communities, and they say, this is a really neat thing we're doing. Do you know we have this is what we're doing with iPads. Seniors take them home and they record how they're doing, and then this is how we can get that real feedback so they don't have to come in all the time. So we've learned a lot of fun stuff, but it's never spread. So now we can take that and start spreading it across the province.
So when are we starting here? Joking, we don't want to get into that. Can you tell us about one recent, well, you just told us about the iPad initiative that I find very interesting. Maybe another one that's been successful in improving access to primary care for and patients' experience in general, yeah?
Yeah, so one of the big ones that we're really proud of, and it's because it is Indigenous Peoples Month, is the Indigenous Support Line. So it is really difficult to navigate the system. If you live in remote parts of the province, it's very hard to figure out where to go.
Yeah.
And when you don't have access to a family medicine specialist like right in your community, knowing where to go, knowing when to go, and then having that in a way that's accessible for your culture has been really important to us. So we've launched the Indigenous Support Line. It's been really successful for people to talk about their experience with the system, so we know where there are problems that Indigenous people face, so we can help address that, but also so we can help them find their way. And we have it in English, we have it in Cree, we're working on other languages and really making sure that we look at the person and the care that they need.
And did you get any feedback? Like what?
Yeah, it started as a pilot. We started it in rural Alberta, and then the urban centers said, we have populations that need this help too. And so we started working with our Indigenous wellness clinics, and then now it's across the province.
Amazing.
And huge positive feedback, like basically universally positive, to have someone who can take the time to listen to you and help you find your way around the system.
Basically reaching out to them,
Yeah.
bringing them to get the care they need.
Yep, from someone that they trust and support, and often they'll call back to have the same person talk to them to help them figure their way around.
Well, you're obviously very passionate about what you do. What inspired you to focus on primary care in your career, and how has that motivation evolved today? I see the passion. I also see the evolution.
Yeah.
What's the most rewarding part of your job?
I think the most rewarding part of our job is being able to help people, like Albertans, just regular people, be able to access care and feel better about the care they receive. And so the best part is going to community and having them say, this is a problem we have, and helping them unstick it and then understand how we can meet their needs, for sure.
And so, an everyday, tell me about like a day in your life. Like just is there a regular day, or
I mean, we're not even 6 months old, so we're very much in a startup.
Yeah.
We don't have permanent office space. We've been trying to sort that kind of stuff out, which is fun. It's fun to be a startup.
Yeah.
But it's a lot of listening to people. I try and remember I have 2 ears and 1 mouth, and so it's a lot of listening to frontline staff. They have been in the system, some of them for 20 years, trying to kind of push that, like moving things forward, and they just can't. And so now we're there and saying, we hear what you're saying. I can either unstick it, or you know what, we can't, but let's figure out how we can do it going together. So it's really collaborative.
And it's been under 6 months,
Yeah.
and you're already seeing results.
Yeah.
Concrete results, like real stuff.
Because like Quebec, there's lots of good work happening. You just have to find it and then figure out how to spread it.
I love it. Okay, this was the easy part. Now we're gonna go into some rapid fire questions. I'm gonna fire, and I mean it's personal but not too personal. Get comfortable though. Okay, so in your practice every day, email or phone call with email or phone call with patients, what do you prefer?
I never communicate with patients because of my job, so it's almost always text, and it's to usually to providers.
Okay, so providers, text.
Yeah.
Really?
Yeah.
Okay, so you get it's
Quick.
personal. Coffee or tea or anything else to get you through your day?
Oh, coffee, lots of it.
Lots of
lots.
it. Yeah, you were drinking one earlier. This was the... I'm going to say...
Under 6. I'm trying to keep it under 6.
Okay, and it's fine. I mean, it's fine. It's fine.
It's fine. Don't tell my healthcare provider.
That's it. When you need to focus,
Yeah.
music, silence, or a busy coffee shop?
Oh, silence.
Okay.
Yeah. I'm easily
You're
distracted.
comfortable in silence?
Yeah.
Do you,
I don't get it very often. So
that's what makes it
So I lock my doors, and then I just start figuring out what's this problem. And I'll be often, it's very late at night or very early in the morning when that happens.
It's a very short period of time. What was your childhood dream?
When I was little, I wanted to be a pediatric cardiologist because I thought it seemed
Impossible.
so cool.
No.
I was like, oh my God, baby hearts. And I knew a kid who'd been born like with a heart abnormality. And then I learned about you can wear a heart on a backpack, like it was like a Berlin heart. It's really cool. We have them at the Stollery. I was like, this is what I want to do. And then I realized I'd have to actually be a doctor. So
how old were you when you
canceled.
were like excited about...
Oh, like I was like 8.
Wow.
Yeah. So I obviously now do the least, like we went from super high acuity to like primary care and care for everybody.
You're still in the system, the healthcare
Always
system.
helps.
So
Yeah.
you were always attracted.
Always
And
helps.
were your parents
No.
No, not at all?
Lawyers and finance people.
Okay, interesting.
They don't know how healthcare works.
Okay.
They're a good test case though, because if they can figure it out, anyone can.
That's great. That's true. And finally, one
Yeah.
last question.
Okay.
What are you most proud of?
Proud of?
Yeah.
For Primary Care Alberta, I'm most proud of how we've brought together health professionals. We have a tremendous amount of change in the system in Alberta, and we've really been able to focus everyone on kind of 4 key things. So one is collaborating, being creative in what we do, being courageous in implementing and trying new things, and then most importantly, being compassionate. And so I have the best team. there are healthcare providers all through the province that we are so keen to collaborate with, that we've already started talking with. And so if we can remember those 4 C's, collaborate, creative, courageous, and compassion, then we can do anything.
And with the positive results that you're getting, you're obviously doing something right, and it's working. Thank you so much.
Thank you for having me.